We're having an amazing conversation going on in the back end, and we want to share it with everyone that may be listening in today. I am in the presence of my collaborative partner, and he is the developer of a personal care product tool called the Thera-Mate. We're also being joined by Dr. Erum Jiva. She's a DNP. She's the founder of Z Healthcare, a clinic dedicated to primary care, hormone health, weight management, and wellness therapies. She holds a Doctor of Nursing Practice degree and is a fellow of the National Lipid Association, as well as the Preventative Cardiovascular Nurse Association. She currently serves as the president of the Ocala Sunshine chapter of PCNA. And she's very, very passionate about helping individuals regain their energy, balance their hormones, and improve their overall quality of life through personalized and preventive healthcare. She's also committed to educating the community about modern wellness solutions and empowering people with practical tools to take control of their health. Welcome into the space, Dr. Erum Jiva. We're happy to have you here.
Thank you so much.
Now, this is a tough one for me, this conversation that we're about to have, Dr. Erum, because I had a very athletic body about 10 years ago. And as I've been navigating the space, I've noticed where I have fell short of my nutrition. I was so on it, prepping my food, making sure that I had, it's almost like my metabolic panel in check. But I also have to admit along the way that I personally got tired of being so on top of it. I used to wake up a certain amount of time during the day before my children went to school. I got that workout in. I made sure I had everything portion controlled. That with this pregnancy, my last one, he's 9 years old now, that I decided, you know what? I want to know what it's like to just not do nothing at all. And I thought that I could get away with it because I had muscle memory, my body was fit, and I thought I had time to regain. And then before I knew it, I went from 130 pounds to today being 201 pounds.
Wow.
And being shocked at how much has changed in a matter of 10 years, but how quickly it happened within several years of stopping.
Wow.
Absolutely. Yeah.
That's
Yeah. Yeah. This is very common, very common. Even I've been through the same phase, honestly, with my pregnancies, that we feel like, oh, this is the time. Cheat a little bit, and one baby will born, everything will be fine. I was told, but my first pregnancy that, the parents pressure that, no, eat it, you'll be fine. When the baby will come, everything will be fine. Honestly, that's not true. Because when I had my first baby, after that, I lost only 10 pounds and the rest was on me. And I was literally, I tried, and it was very hard. It's easy to put on, and it's hard to get rid of it. And I felt like I was end up with a depression because our body image, self-image is like, completely gone. I mean, I was like, I don't know if I would be able to lose it or not. Then I started my own weight loss journey, and that's why I'm really passionate about it because I know what it feels. I know what we as a women go through it because of our menstrual cycle with the menopause stage. We go through so much, and it's hard sometimes that despite we are on top of our meals, despite we are on top of everything, the portion control, there are the hormonal hurdles which hard to go through and to reach the goals achieved. So I completely relate. So when you are talking about it, I've been through the same. I do see a lot of patients with the same thing, and that's why I like to talk about it so I can educate women's and also the men's, because many times we forget about them because we feel that women's go through the hormonal phase and we go through it, but the men's honestly go through the same things as well because they have hormones, of course. They also go through the same thing after the age of 40. Everything shifts around, but sometimes they feel like strong and body is like trying to compensate. So they realize little later, but they go through the same stage as well. They need attention, help, some help to, for the weight loss, and same like the women's need, I feel so.
And
I
I'm
have
glad
a
that you brought
question.
that into the space because we do have, right, my collaborative partner, he's the male voice in the space, that he can truly talk about, how navigating in a relationship also changes your diet, because I know with me, before we give the mic to Mr. Don Brown, I know with me, my husband had an athletic body, and this was his first child with me. And I was so emotional. And I was like, you're going to have me eat my food by myself? And I have all this food and you're not going to eat it with me? And he's like, I'm watching my weight. I don't want the ice cream float because it was one of his favorites, but I didn't know. And I'm like, you're not going to share this with me? And I have two straws, just the emotional part.
I
And it got to
know.
the point that I made him, and I say I made him because we do have influence over other people. I made him join me. And once he had his temptations, kick in, now he's gaining just as much weight as I am. So it's like together, we're
I
like this
know.
seesaw,
Yeah.
and then together we need to also put the nutrition back in, put the exercise back in. So, yes, thank you for bringing the male, to that we don't forget about them and to bring them into this space. What do you have to say about that, Mr. Don?
That was when she said that. I didn't really know about that. I've been told that sometimes men go through hormonal changes, but I don't think I. How do you know when you experience it? I mean, how would it's because I don't have any weight issue. So for me, if I was to speak from a position of an experience, I have not yet experienced that. And if I did, I don't even know that I did. So
Yeah.
what is the difference between a male experience versus a female experience? And what is a noticeable change when that occur? Because I would like to know, have I changed? Because if I have, then maybe that can account for some of the things that when I be talking with my wife while I act the way I do. I don't know. She's in the
Yeah, no. Yeah, absolutely. And it's a really good point because the thing is that when we talk about the changes in the men, it's not necessarily, and even with the women's, many times they are not obese, they are not overweight, and it's not because of their weight. Sometimes it's a hormonal change where you can see other symptoms, which is the most common, is like feeling fatigue, tired. They feel like they're completely drained. Like initially, when you shared that you were so active, you were really into it, like getting the portion control and everything. And then all of the sudden, it's like, oh, I'm done. I can't do it anymore. This is one of the signs. So fatigue, tired, losing muscle mass. Sometimes you're not putting on the weight, but all the weight is on your abdomen. So which is another sign that you are just collecting fat at one part of the body. That's your hormones are messing up and your body is not able to metabolize the stuff properly. The other is low sex drive. Many times I hear from the men that they need the prescription medicine, but the key is that we need to find out the root cause rather than just prescribing them the pills, because that will help with the problem, but it just at that point in time. But if there is a cause and the cause is the hormones, we should fix the hormones.
So for instance, what have you noticed with maybe someone with my physique that really don't have a weight issue, but are going through those emotional, physical changes that is not readily seen with a smaller frame person versus a person that's a little bit overweight? Because I would imagine a person that's overweight is dealing with not only is he dealing with his emotion, if that may be the case, but he also, those emotions arrive from the mere fact that he may not be able to lose the weight that he care to lose, and he get frustrated over that, got this big girt, big stomach and stuff, and can't seem to lose that. Don don't have that issue. So what would be a case like my case where I don't have those type of issues, but yet there are things going on with me from a hormonal standpoint?
See, honestly, what I believe and I have seen in, I would say 99% of my patients, that they are going through the hormonal changes is just as hard to recognize it. The best way is that proper follow-ups with your provider, proper blood work, so to know that where you are. It's not necessary that everyone needs a hormonal replacement, but it is necessary to know your hormones, know your blood levels. Like we know our lipid panels, we know our cholesterol, we know our blood sugar level. Same way, the hormones are very important for all of us, either as a man or a woman. So it's important to ask your doctor that when they do the labs, add the hormones and try to figure it out, because many times patient comes and they're like, my labs looks completely fine. I've been told that my labs are good and I'm having all the symptoms. They never had their labs checked properly. They never had their hormones checked. They never had their vitamins checked, and they have the symptoms. So it's very important that we have to advocate for ourselves now, that we need to let our provider know that if I'm going through the symptoms and all labs good, there must be something, some root cause. So we need to investigate further rather than just been suffering. Honestly, uh, believe in the quality of the life rather than the quantity. We all need that quality and we all deserve it. So the best way is just to have a proper blood work to know.
No, okay, okay.
I'm glad you brought that into the space, because coming from like the mental health perspective and the perinatal space, that's that's where, the area that I work in, on top of also being a death doula. So we're talking about the transitional stage, but the mental health piece. I sit across some clients that self-diagnose. They tell me, "Oh, I'm going through a depression, or oh, I have anxiety." And even though we do have certain modalities that we can use, right, to give them anchors as they're navigating
Absolutely.
whatever, right, whatever social determinant, whatever life experience they're going through, I notice with some of the clients, I need to send them back to their primary physician, because when they're self-diagnosing themselves with depression, with the lows, that down feeling, they're linking it to a mindset and an emotion when it's a hormonal thing. And I'm also
Absolutely.
noticing with some clients, when they say that they have that anxiety,
Tell
right? That they're like, "Oh, I'm feeling anxious about something." And we put in place the modality and give them the anchors. I have to send them back. Go back to your primary physician, because now it's a state of checking your blood pressure, the blood sugar, because there's something that's increasing the heart rate, and it's not necessarily anxiety. What are your thoughts about that?
Yeah, I completely agree with that, because many times I see the same cases that they nowadays, everything is on internet, right? So we
Right.
Google it and we put our symptoms in and we are like, oh, I have a depression. Okay. So it's not necessary. Many things, many things, has a root cause rather than just labeling it as a depression or anxiety. Yes, there could be a depression because you're overweight or obese, as I shared my example, that of course, whole of your life you are, good weight and you see yourself very different than after the pregnancy, your weight is different. Of course, it's a shocking stage for the body. And when you try to lose weight and you cannot, of course, you will feel depressed. But the root cause over here is not the depression. The root cause over here is the overweight or obesity and your body's self-image, that leading to the depression or the anxiety. So rather than focusing on the main diagnosis that, okay, here's the depression is, and put the patient on the depression pill, or patient is coming with anxiety, so just give them the Xanax so they will feel better. As a provider, I feel that our role over here is to educate the patient. First of all, find out the root cause, that what making them depressed, what's going on. Give them enough time when we have the office visit and understand them so we can help them out to fix the root cause rather than just pushing the pills for the depression or the anxiety.
Oh,
Absolutely. And also to put in place that you have a part to play. The person, and I'm going to put myself in the space, right? Because we don't want to single anyone out. Whoever might be listening in, you know, if the shoe fits. For me, it's not so much feeling any type of depression because I know that I did this to myself. I know that I lowered my activity. I know that I stuffed my mouth with things that were going to be excessive in fat and in junk food, and that I wasn't doing the necessary activities to burn it off. So, I have to have some personal accountability to that. And then also, let's say perchance that I did feel some kind of depression in my mood, to also understand, did I wake up in the morning and keep the commitment to myself to do the portion control or to take the extra steps? Because even
Absolutely.
now, I have to be perfectly honest. I could have ran up and down the stadium stairs like it was nothing. And I used to pride myself at the age that I am. When I'm 52, I had my last child at 43. And at that stage, I used to say, oh, I could do more pull-ups and more push-ups than these 20-year-olds. So I noticed the change. And then as I go up and down the stairs now, I'm out of breath. I am not out of breath because I'm having a heart attack. I am
Mhm.
not out of breath. You know what I mean? For
Yeah.
for any other reason, is because I am not fit. My body is not used to putting on this extra activity because it was laying dormant for so long. But I'm also
Mhm.
noticing that in that dormancy, that there's weight being gained in other areas. For example, my arms. I know that some people call them bat wings, when
Yes.
they get heavy. My legs. My legs, when I
Mhm.
look at my legs, I go, is that cellulite or is that the kind of fat, what is it, the visceral fat that stays over the tissues and the muscles? So when you talk about education, that right there is very important. Then when you work with someone that has some level of knowledge for the autonomy, there comes in some personal responsibility to what you're seeing and what's occurring.
I
So share
know.
about
Yeah.
that.
Yeah, accountability is the key, with the patients or anyone, because if we take the accountability, we would be able to do it. Sometime for like self-awareness, I would say is very important. First of all, like in your case, as you are sharing, that you are aware that what lead to it, and you know that how to fix it is all you have to do is just take the accountability and start working on it. There are patients who do not have that awareness. They feel like they have not done anything wrong and it just happened. And one of the reason is that, as we all know, that you do not gain weight overnight. It's a slow process. You keep gaining over the time. So we feel like, I'm doing all right. It's just, I don't know why it happened. Sometimes it's true because it's just their hormones and is not they are not want to do it, but their hormones are so messed up that they are so much tired, fatigued that they cannot do anything. In that case, no matter how hard they will try, it will be difficult. Versus sometimes there's a case that it's not the hormone, it's just their lack of awareness. They don't know what to do. Like simple thing that people
mm,
feel like, okay, I need to go to the gym and I don't have time to go to the gym. But you can do walk outside. There are people who are not nature lover. They don't like to go to the gym. So just thinking of it that, okay, I need to go to the gym and I have no time versus just taking time out after each meal or taking time out to just walk in the nature and start with some healthy habits. So it's really matter of the awareness. And I would say that as a provider, it's our job also that when we have patients, we should start talking more into the preventive side of the medicine versus just, that, okay, you need healthy lifestyle. It doesn't tell a lot. We need to educate our patient. And same time as a patient, it's their responsibility to be accountable. So then they would be, it's like a partnership, as a provider, you can't do it alone. You need your patient's help and patient needs our help. So if we can work together, we can help our patients whole lot.
Wow, that's very powerful. Like on Monday, what I do is that my wife and I, we walk about 4 to 5 miles. And when I get back, I still have a burst of energy. I'm not tired or anything like that. I just feel like I can do other things. So I'm back on it again. I don't know about those hormonal changes. So am I supposed to be experiencing that now at my age? I mean,
Yes, ideally, yes, if there is a hormonal balance. And it's not necessary that everyone can have hormonal imbalance, but I
okay.
would say that it's good to check it out though. It's good to check it out, your numbers. So at least you know. So just in case after like couple years you feel like it, you have something to compare. So even if you're feeling well, like you check your regular lab work is important to check it out. So when you are not feeling well, you have something to compare that your levels are, you can see the trends basically, and you will know that what's going on with your body.
Tell me this here. What are some of the things that you pride yourself on being a doctor and dealing with your client base? Some of the things, changes that you've noticed that contributed to your input and you being involved with them. I'm quite sure, in life, we always have those highlight moments where we feel good about ourselves to say that I'm somewhat responsible for that positive change in that person's life. Have you encountered that with any of your clients and basically kind of walk me through how you felt about that? What was that like for you?
Sure. Yeah, I do have like, lots of pride moment. For me, the best moment is when they come up and they feel better. Of course, I feel good because that's the goal is. Uh, for the weight loss patient, like I have my lost about more than 150 pounds. So of course, when they get their goal achieved, I feel good. I do get lots of patient who comes for the weight loss because they want to prevent them from the surgery. And I get lots of referral from the ortho doctors where patient needs a knee surgery and they send it over to see that if weight loss help, and it does. So like after 3 to 4 months, they start verbalizing that, hey, I feel better. Now I'm able to walk. I feel like, yes, that's what I want. So that helps. With the hormone patient, usually after 3 months, I can hear from them that, my life is completely different now. I used to be like completely down. I had no energy. Now I'm able to walk. I'm able to go gym. I'm having different energy. I'm by myself, but I used to be. So when they come and when they are happy about it, that makes me feel satisfied that yes, I'm getting my goals achieved.
Right. Have you ever experienced the fact that someone was getting ready to have a gastro bypass surgery and then they came to you and then they averted that from happening? Have you ever had that type of an experience?
Yes, I have a couple patients like that where, as I said, they lost around 100 to 150 pounds and they are like, they were to the point that, okay, there's no other options. And, I have to go to the surgery, but I don't want to do it. I have patients who are ready to go for the tummy tuck and they come and we work with them and they have lost weight. And we have different treatments over here, which helps to tighten the skin and everything. So basically, our weight loss program is from the metabolic test to analyze the root cause till the maintenance phase and help them to tighten their skin and everything. So it's kind of a medical and aesthetic in the combination. So that way they get everything under one roof and everything to be dealt in a way that it's supposed to be. So when they're done with the weight loss program, they will achieve the goals which they came here. So they feel like they get everything in here, so they do not have to go through any invasive, I would say,
Right.
procedures or the treatments or the surgery. So yeah, I do get those patients and they feel so good. Again, I always tell them that it's a journey, you know. I need their support, I need their willpower. Same time, some patients, because it's not a surgery that it's gonna happen overnight. I don't
Mm-hmm.
like to just,
Yeah.
push too hard and then we lose weight and we put on. We wanted to lose and sustain the weight loss. So I feel myself successful only when they come after a year or 2 years and they say that I want to lose more, rather than they come and they say, oh, I put on and I need to restart. I do not like that. So
Ah.
our goal from day one is to lose the weight and sustain the weight. And then if needed to come back, is to lose more, not to lose what they have lost before.
So when they've lost that weight, you get in one part of your business is that you do your services that you provide is body sculpturing, right?
Yeah, we do the cryotherapy and the body sculpting. And I would like to mention over here that there is always a misconception that when they do the cryotherapy is the aesthetic. It is aesthetic, but cryotherapy can be aesthetic and can be medical. So, like if I have a 70 plus year old, they might not interested to sculpt the body and, be a model shape body with the tight skin. They just want to lose weight because they want to be healthy. In that those conditions, we do the cryotherapy just for limited session, just to decrease the inflammation down in the body. So the cryo is a cold therapy. One of the reason of the cryo is to tight your skin, increase the collagen, decrease the cellulitis. But the other reason is to decrease the inflammation. So just imagine when anyone who's putting on the weight, you always see that most of the part of the weight is on your abdomen. Now that is a fat. Now just think about it, that fat is sitting there for so many years. What it
Mm.
does, it creates the inflammation. So I recommend my patients who are on the weight loss program to do at least 6 sessions of the cryotherapy to decrease those inflammation. And we have seen that patients who does those cryo just to decrease the inflammation, their weight loss journey is more successful and more sustainable as well. Because you're kicking out all the fat cell, you decreases the inflammation. So sometimes it just kicks in and you start losing weight. So patients who are stuck, it works out really great.
I think that that's an important thing to talk about for a moment because, as you mentioned earlier, about the partnership and the journey, right? Because it's all encompassing. So the weight doesn't come on overnight. It comes on little by little, but to your eyes, it looks like this came from nowhere. I woke up this way, so to
Yeah.
speak. And then the awareness piece, like you said, some are aware of it, some people are not. And then that moment too, that part of the journey where it's the call to action. Okay, so now you know, or now your doctor told you, what are you going to do about it? And then, like you said, in your place of business, we have it all in one umbrella. So we can take you to step 1, 2, and 3. So now I'm just going to give you the scenario that happens for many of us, myself included. I just consider myself to be in that early stage that I jumped to 200 pounds. Notice how I said that I jumped. We know that it happened over time. But then there are those that are 400, 600 plus. I watched the TV show, My 600-Pound Life. So when you're working with someone at that extreme, and I say extreme obese because even 5 pounds overweight, I was considered obese. You're 5 pounds, your BMI, but now we're talking about extreme. And I say extreme because it's not only in the physique, it's not only far along in their health journey, but it's in the work that they're going to have to do. It's extreme work. And if you're already tired, just waking up in the morning to swing your legs out of bed. And this is just a scenario, swing your legs out of bed, then whew, to catch a
Yeah.
breath. Then to make sure, depending on the height of your bed, to make sure that your feet land on the ground. Then when your feet land on your ground, most probably your feet hurt. from shifting and carrying all that weight. Then you hope not to drop something, because then you have to bend down if you can, because of all the rolls of your stomach. So you understand, and I know that you understand, but I'm just giving this visual to those that might be listening in, and that they also might be experiencing this, so that way we tell them that we see them and we understand, and that we're here to give them this information to help. That you don't want to drop nothing on the floor, and not in public, because then you're standing up and it's like, does your shirt fit right? Does the pants fit right? Does your skirt raise up? Because many people that do gain weight, they don't know how to dress anymore. And I say that lovingly, because you don't know what size you are. And then when you do realize what size you are, you don't want to buy that size, because you remember of a time. You understand when and then
Absolutely.
you go to the bathroom to do the regular everyday things, to wash your face. But when you look at yourself in the mirror, you don't recognize that face, because even in your face area, you have gained some weight. I don't know if the weight on your face is inflammation, you know what I mean? Or if it's fatty tissues. I don't know, but I know that the face looks different. And then the emotions kick in. And then
Absolutely.
what do you do when you have to wash up? Are you, if you have a bathtub, it's lifting the leg over the size of the bathtub and hoping that you don't slip on anything and hurt yourself. Lifting your leg up over the bathtub and maybe looking at not having it cleaned, because you didn't have the energy to clean it, because you don't have the tools, you have to bend down. Then to wash yourself in hard to reach areas. And many of them don't have those easier care tools. So now that I gave this scenario, Dr. Erum, right? And then we talk about some tools that people can have outside of, the doctor, outside of the physical therapy, outside of maybe medicine that they might need to help them lose weight. But that's not a quick fix to prevent the surgery. The easier care tool that I found helpful for me was the Thera-Mate. I didn't have a tool like that before. I was trying to make tools like that for me. But when I came across the Thera-Mate, I'm like, oh my goodness, it makes it easier so I don't have to bend down. Not that I don't want to bend down, but it's just that it takes the weight off, and I'm able to reach in between my toes. I'm able to scrub, this movement right here, because this right here, I just hurt my shoulder again. To do this movement, not even to put my hand back to wipe myself, but what about to clean? And then the reaching down, those body movements. Can you please talk about like the body movements, because it's difficult to shift the body with all that weight and not having done exercise. Things feel stiff. Things are heavy.
I know the way you did a really full justice. I would say the way you described it, I visualize so many of my patients like that when they come and start the weight loss journey over here. And honestly, I call that thermo is a magic wand for them, because again, when we talk about the weight, obesity, weight is one of the issue for sure, and it is causing so many other problems. Many times there are things which we forget about it, honestly, because when we see the patients in our office, we are more focused. Okay, you need to lose weight because it can cause a heart issue, it can cause a stomach issues, it can cause you other issues. If you do not lose weight, you can end up in the depression because of the body's self-image. But the important thing which we always forget about it is their personal care, how they are doing it, how they are managing those things. I think it's a key, because when we talk about the self-image, our body is not clean, how are we going to feel it? So just imagine, as you mentioned it, that how they feel. I mean, that is the one of the reasons that they end up with so many issues, and they are not comfortable to talk about it, honestly, because I see so many patients, but I do not remember anyone says that, hey, I have a trouble to just, clean myself. What should I do? Because they feel not good to talk about these things. But as a provider, we should have some some, I would say, that magic wands like that to help our patients so they can feel comfortable and they can do their self-care while they are dealing with all the issues like this, you know.
Yeah, and I think that that's a moment to talk about as well about the collaborative effort of professionals. All three of us are
Absolutely.
professionals in our space. Now, while the client or the patient might not come to you, Dr. Erum, to talk about that part of their life, they come to me to talk about it in the mental health
Hmm.
space. They come to me because I ask them what makes you feel uncomfortable. And what makes them feel uncomfortable is the inability to move around like they used to, whether they have children of their own or grandchildren. Their inability to they it's like making the attempt to exercise, but getting too tired to go through all the 10 steps at 3 repetitions each, you know what I mean? Or three heavy weights at 10 repetitions each. Is that motion that some of them come to me and say, I thought I washed the best that I could, but I noticed by the look on somebody else's face that I had an odor.
Yeah.
You know, it's things like that that they bring into the mental health space when they trust, because there's no healing without trust. There's no healing without feeling
Absolutely.
safe. So for me, I look forward to collaborating with professionals like you two, because when I have a client coming in, then I can say, well, you know what? I'm connected to Dr. Eram. And if you go to her clinic or to her place of work, she has everything under one umbrella that can help you with your metabolic panel, that could help you understand your hormones, that maybe this time when you begin your weight loss journey, it sticks, because they don't just do it once. They make the
Mhm.
attempt, and in there, they feel overwhelmed and then they quit. So then also when that client comes in, I can also say, you know what? I met this amazing developer, Mr. Don Brown, and he shared with me this amazing tool, which Dr. Eram calls the magic wand. And although it's difficult for you to move around, this will make it easier on your journey, because nothing is a quick fix. Nothing is a miracle drug, pill, tool. It isn't. But it can give you that the inspiration and the encouragement to try again. And this time make it
Absolutely.
stick, because you have support, you have education, and you have three professional individuals working together to make your journey as best as it can be. That's what I'm in this for, Dr. Iram.
I
You
know, I
know,
know. When Don bring it to my facility, I'm like, okay, that's what we need, you know. Absolutely. And we have our staff trained how to teach this to the patient. So at least they know that there's something exists like that, because I don't know how many people knows that there is something like that for them. I don't think so. They know about
no,
it.
they don't. And this is why this conversation is important, because listen, we don't want anyone to slip and fall in the bathtub. We know, listen, money is tight for a lot of people. And I say a lot of people, the majority of our clients that come to
Right.
us that need insurance. They're not gonna, for some of them, I can't tell them, well, you know what? You have that bathtub, that old school bathtub that you have to raise your leg this high, and you don't do enough exercise. We don't want them to lose balance. We don't want them to fall and then cause another, right?
Mhm.
Another thing to deal with. Now it's an injury on top of the weight loss, that we know that even makes it even more difficult for them to heal, brings on even more depression and anxiety. It just really does. It's human nature. We're all human beings, so I
Mhm.
tell them you could sit at the edge of the tub. Once you get your legs over, put a towel so you don't slip your soapy behind, off the
Yes.
back. Put a towel there, sit at the edge, and go slow, because that's
Mhm.
exercise in itself, to bend over with all the layers of fat on the abdominal area, to twist to the side, right? That's exercise in itself. Try to touch your toes, but with this tool, not that you don't bend, you do bend,
Mhm.
but you don't have to force. Because, I don't know, Dr. Ibram, have you met those clients that, you tell them that they have to exercise and they haven't exercised in a long time and they go hard, and it's like, don't force yourself to the point of pain.
I know. I'm so used to of telling them when I say about the exercise, I usually ask them that what you are right now doing, to know the baseline. And then I always tell them, I don't want you to run a marathon because you're not doing anything at all. I want you to start with 10 minutes, then build up 15 minutes, 20 minutes, but do not try to run a marathon. It's not going to save for you. So just slow and gradual, you need to build up.
Oh, well, which brings me to the point where, and I'm listening to this conversation, and again, I don't mean to sound well, for lack of term, I don't want to sound like I'm bragging or anything like that, but I don't know what that's like, to deal with that type of situation. And maybe if I had experienced that, then I could be more in tune with it. But from me being from an engineering standpoint, I think that I am because I saw the need for a device like this to be able to aid with those particular clients. And here's one unique situation what brought it home for me. I go into people's homes and I fit them for diabetic shoes, right? Because that's another part of my business. That's sort of how both of these items go together, the Thera-Mate and the diabetic program. So there was one patient in particularly that lived alone, and basically I could look at her feet and tell that she hadn't taken care of her feet in months. The buildup of dirt, the buildup of crust and things like that. But I knew that that was a situation for her, and she was sort of embarrassed for me to see her. She started apologizing immediately. Hey, I'm sorry that you're looking at my feet like this. My granddaughter, she comes over, but she don't never like to help me with my hygiene when it comes to my feet. She don't want to help me with that, and I can't reach that area, and I'm just embarrassed for you to see it like that. So when she said that, I understood the emotional problem that exists with that kind of condition. And I started thinking, I said, well, I have something in my car that maybe can help you. So I went out of my car and I got the product and I showed her how it works. She literally started crying because, and the reason why is that I realized that she was in a space and in a place in her life wherein she needed someone to do those mundane tasks. And she didn't want someone to have to do that for her. And when I presented this to her, I saw the pressure being released off of her shoulder. Now she didn't need her granddaughter to come over, to relieve her of that burden as if it was a task for her. She forgot all about the shoes till she started talking about how the product is going to help her life from a personal standpoint. That's why I asked you earlier, are there anything that you've done that you really outside of your medicine that you was able to do that you saw where you gave that person hope, and that was the situation that I experienced when I gave her that. I went there for one thing, but then I walked away with knowing that I helped them to be able to overcome an objective and a problem that existed with them for years. And I must admit, I felt good about that, you know?
Absolutely. It
That,
definitely makes you feel satisfied,
yeah,
I mean, I would say personally, when these situations happen, it's hard to describe, but you know what you feel when you
right,
make someone happy, help them out with the basic thing which they thought that it's not going to happen with them. So
right.
it's a different feeling, I'm telling you.
Yes.
And for
Well,
anybody that's listening out to this conversation and has been experiencing any of the things, the situations, the thoughts that we have spoken about, there are professionals out here to help you. And while you're navigating whatever emotions and feelings you might be going through, just understand that those are your feelings, and it's okay for you to have your feelings, but do not let that stop you from reaching out to Dr. Erum, from reaching out to Don, for reaching out to someone like myself that's in the mental health field and getting the help that you need. Even if the thoughts cross through your mind, oh my gosh, I feel disgusting. Oh my gosh, I smell. Oh my gosh, I can't move. Oh my gosh, I don't know where to start. Just you having breath in your life is the point to start. Have the conversation. Look out for the information. There's always new technology. And there are professionals like Dr. Erum. There are professionals like Mr. Don Brown that will look out for you and tell you, hey, try this. Because in the trying something new, you might find that breakthrough. You might. I
Sure.
appreciate the conversation that we have all had today. And Dr. Erum, I look forward
Yes.
to sitting with you and having more conversations so we can help our communities out here.
Absolutely, absolutely. Anytime. And yes, I mean, anyone who's listening to the conversation, feel free to reach out to us. I would really like to mention over here that our first consultations are free, so do not worry about it. Just set up the appointment. I'm always there to help out and educate you guys. So if you have any way which we can help, just reach out to us, and always there for you guys.
Very, very good. I really have enjoyed this moment, this place and time, and especially where we are now. From my standpoint and what we do here, we develop ideas that raise the quality of life. That is our journey, that is our mandate, and that's what we are committed to. We're always looking at opportunities to make your life a lot better, to add that portion of your life that you may have had questions as to how will I navigate this portion of my life now that I'm here? Well, here at Bit Technology, we develop ideas, as I said, that raise the quality of life. I really appreciate the opportunity, Doc, for you to be on with us. Hopefully, we'll have you on again and you can share a lot of those
Thank you so
nuggets
much for
and the
having me.
wisdom that you bring to the table. And to my esteemed partner, Yuvelca, who I really have the utmost respect for. She's more than a blessing to me, but she's a blessing to the community.